at Johns Hopkins Medicine.
Known for groundbreaking research, teaching, and medical care.
Hello, and welcome to a special Facebook Live here at Johns Hopkins Medicine focusing on the heart health. I'm Dr. Ari Cedars, Associate Professor of Medicine and Director of the Adult Congenital Heart Disease Center. Joining me for today's conversation is Ashish Doshi, Assistant Professor of Pediatrics and Interim Director of Pediatric and Congenital Cardiac MRI at Johns Hopkins Children's Center, and Anam Minhas, Assistant Professor of Medicine and Director of the Cardio Obstetrics Program here. Welcome, guys.
Thanks. Happy to be here.
Yeah, excited.
For the next 20 minutes, we're going to discuss a range of heart issues, including conditions which affect both adults and children, signs and symptoms of heart disease, and tips to keep your heart healthy. But we also want to hear from you. So please, during the program, leave your questions in the comments section, and we'll do our best to answer them while we're live. But first, why is it so important that we're here today? You may not know it, but heart disease is the #1 killer worldwide, claiming nearly 20 million deaths globally in 2021, nearly 1 million more than the previous year. Here in the United States, heart disease and stroke claim more lives than all forms of cancer and chronic lower respiratory diseases combined. There are about 2,550 deaths from cardiovascular disease each day, averaging a death of every 34 seconds here in the United States. It is estimated that 25.5% of U.S. adults have elevated levels of what is known as bad cholesterol, and 47% are estimated to have high blood pressure. Let's start with the obvious question here, though. What are some of the reasons why heart disease continues to be the #1 cause of death worldwide? Dr. Minhas?
Yeah, so it's a really important question, and until 2014 or so, the number of deaths from heart disease was declining in the US, and after 2014 it's been rising. Why is that? So both in the US and worldwide, we have an increase in obesity and overweight, and this is true for children and this is true for adults. We have more sedentary lifestyle, so we're not as physically active as we used to be in the past, and our diet has drastically changed. We have more use of e-cigarettes, particularly among youth, and all of these things can be contributors to diabetes, to high cholesterol, to high blood pressure or hypertension, and ultimately heart disease.
How about children with heart disease, Dr. Doshi?
Well, when we talk about children with heart disease, there are generally three major categories. So one is congenital heart disease. Those are the heart problems that children are born with. And generally these are structural heart problems, say a hole in the heart, a valve problem, or even something as severe as an underdeveloped or missing heart chamber. And congenital heart disease affects about 1% of all births. It's the most common birth defect in children. Of that 1%, many of the conditions are fairly mild, but about 1 in 4 children born with congenital heart disease will need some type of surgery or procedure within the first year of life. And even after those surgeries or procedures, it's important for them to continue to get lifelong care because there can be long-term consequences. The other type of heart disease that we see in children are cardiomyopathies or heart muscle problems. And so we see these in adults as well, where the heart muscle either is weakened or thickened or does not pump as effectively. And this can be due to some genetic causes as well as some environmental causes, such as certain viral infections. And then finally, the last thing we see in children is arrhythmia syndrome, so abnormal heart rhythms. And these we see in adults as well, where the heart does not beat normally, and this may be something as simple as a abnormal heart sensation or palpitations, or something significant enough to cause people to pass out.
Thanks. So you've mentioned that there are a lot of risk factors for heart disease which have become more prevalent recently in the adult population, and you've mentioned that we have a lot of heart disease in children. And so I suspect that there are a lot of people out there who are wondering, what are some of the common signs and symptoms suggestive of heart disease? So why don't we pivot and talk about that? Dr. Minhas, what are some common signs and symptoms of heart disease in adults?
Yeah, so adults, both men and women with heart disease, will typically present with chest pain. So heart attack will often come on as sudden chest pain, grabbing the chest. Somebody might describe it as a pressure or an elephant sitting on their chest. But then there can be other more subtle symptoms. So women, for instance, might be a little bit more likely to be short of breath or to feel very, very tired one day, unusually so. such that they can't go up a flight of stairs, that they can't complete their chores around the house. And it might be the case that women might have those symptoms a little bit more so than men. And then we didn't really talk about stroke because, the focus here is really heart disease, but we do include ischemic stroke under the umbrella of cardiovascular disease. And in that case, too, women might be a little bit more likely to have stroke and might have slightly different symptoms with that.
And I heard you mention that women and men may experience somewhat different symptoms of heart disease. Are there other ways in which men and women differ in their symptoms when they come in with heart disease?
Yeah, so, first we talk about the symptoms, which is how you feel when you come in with a heart condition. So in that case, like I was saying, women might be more likely to have shortness of breath or feel lightheaded or be sweating or have jaw pain as opposed to that classic pain on my chest, someone sitting on my chest. And then there might actually be differences in the form of heart attack that a woman has. So women we know are more likely to not just have what we call plaque rupture, which is that most classic form of a heart attack, but might have the forms of heart attacks that get missed. So even if they have a heart cath, they might be told that they don't have heart disease, when in fact they do. It's just a different form called myocardial infarction with non-obstructive coronary disease.
So important to know that men and women may present differently and actually have different things going on. Mm-hmm. Yeah. How about kids? How are they different from adults, Dr.
Yeah,
Doshi?
so in children, the symptoms and signs of heart disease are fairly different from adults. And fortunately, in children, chest pain is fairly rarely a cardiac cause or a heart problem. Only about 5% of chest pain in children is due to a heart problem. And so the signs and symptoms of heart disease in children really varies, and part of it has to do with the age with which they present. So as you can imagine, an infant can't tell you that they're having chest pain or palpitations, so we have to identify some of the signs. And so for infants, a lot of it will be signs. So are they not feeding well? Are they not growing well? Are there breathing problems? So as you know, the heart and lungs are intimately connected. Sometimes breathing issues can be really due to a heart problem. Other things are things that can be identified by the doctor. So a heart murmur, which is an abnormal heart sound that the doctor can listen to. Other symptoms in babies in particular are low oxygen levels. And so this may appear as a bluish tint to the skin, although the definitive test for that is really a pulse oximeter test, a test that your physician can do. And actually, any baby born in the United States in a hospital will have this test done before leaving the hospital to check for any of the severe forms of congenital heart disease. As we go to toddlers and kind of older children who are more mobile and able to verbalize their symptoms, again, the symptoms may not be the classic ones that we think of. They may say something like, my heart is beeping or my heart is fluttering. And so it's important to listen to those symptoms. Also things like passing out or losing consciousness, that's never normal in a child. So that needs to be evaluated. Also, just kind of arrest inactivity. If the child is running around and suddenly stops for some reason, that should be a cause for concern. And then finally, as mentioned, chest pain can be a cause of heart disease, but in particular chest pain with exercise. So any symptoms with exercise, we really do get concerns because that's when your heart is really working at its most. And so chest pain with exercise, passing out with exercise, shortness of breath beyond what you would expect with exercise, those are all concerning symptoms. And then finally, just a decline in physical activity that's unexpected. So you used to be able to go up three flights of stairs, but now you go up half a flight and you feel suddenly winded. That's a reason to really see your doctor.
It must be really challenging to take care of such a broad array of ages and different developmental stages in your heart disease clinic. I think that must be really tough. Thanks for summarizing that, man. So switching to a popular topic among athletes in all ages, in recent years we've seen some pro athletes suffer from a cardiac event while doing high-stress physical activity. A common question parents may ask is, should my child participate in sports? What are some of the things that someone who may have heart issues should consider doing before doing physical activity or engaging in sports?
Yeah, so exercise is certainly one of the best things you can do for your heart. And the risks of any exercise are far outweighed by the benefits to your cardiovascular system. And studies have shown that it's not just the typical aerobic exercise like running or bicycling that's beneficial. Weight training is also beneficial. But really the important thing is talk to your doctor before starting an exercise routine or really before starting competitive sports. This is why we have pre-participation sports physicals for children to identify any concerning symptoms. Now, there have been some of these high-profile cases in recent years of athletes having cardiac events during exercise. And that does raise the question, are these getting more common? And actually, there's a recent review over the last 20 years of collegiate athletics looking at cardiac events. And actually, if anything, it's actually been on the decline. It's just that nowadays you pull up Twitter, Facebook, whatever, and you see all these things. News from all over the world comes to your smartphone, whereas a couple decades ago, you wouldn't have this. You had some of the high-profile things like Reggie Lewis or Pete Maravich, but you didn't hear about these smaller things happening in high schools and colleges. So fortunately, the incidence of cardiac events during sports is fairly rare, about 1 in every 100,000 or so. But it is important to have that pre-sports physical to identify any risk factors. So risk factors really are symptoms with exercise, like we discussed. Any type of symptom of chest pain, passing out, concerning symptoms during exercise, that's a reason to talk to your doctor and have further screening. On the physical examination, the physician can identify a heart murmur or other concerning findings. And then finally, the family history is very important. If there's a family history of sudden death and unknown deaths, especially during exercise, those are reasons to look for any kind of inherited cardiac problem.
Thanks, Dr. Doshi. So I guess the underlying message is talk to your physician before engaging in aggressive or competitive physical activity. Mm-hmm. Now, we do have a question from a Facebook Live viewer. Can heart conditions like you have as a child, such as a heart murmur, be passed down through generations? Dr. Doshi?
Well, so as we discussed, a heart murmur is just a abnormal sound of the heart. Sometimes it can be a sign of a heart problem, but many times it's just a normal extra sound that the heart produces. There are certain conditions that can be passed down, but they're variable, and so some of them have a true genetic linkage, and those genes can be passed down. Other things are a little bit more loose. And so, for example, someone born with any type of congenital heart disease, some sort of hole in the heart or heart valve problem or something like that, their child has an increased chance of having that, but it's not a sure thing. And so, yes, the answer is yes, it can be passed down, but it's not always a clear linkage.
And you know, this seems to actually be a perfect time to segue into some of the work that you're doing, Dr. Minhas, in the cardio-obstetrics clinic. If a mother has congenital heart disease, what might you recommend that she do during pregnancy to see whether or not her unborn child may have congenital heart disease as well?
Yeah, so I think it's really important for women to be aware of this, Dr. Cedars and Dr. Doshi, and that's because most women in the U.S. will have a baby at some point. So mothers should be aware of what they should do. And if a woman has a heart condition, we recommend that she definitely be established with a high-risk obstetrician or somebody who's comfortable managing the mother with her heart disease, but then also someone who can counsel the mother on what the risk might be for her baby. And that will frequently be either a cardio-obstetrics provider like myself, so somebody who's an adult cardiologist who takes care of pregnant women with heart disease, or someone like yourselves who is an adult congenital heart disease provider who has comfort in treating, everywhere from babies all the way to adults with heart disease.
Important information. So if you're born with a heart condition, make sure that you get specialized care during pregnancy. Mm-hmm. Now, I've heard that African Americans and minorities are disproportionately impacted by heart disease, and they may experience higher rates of both risk factors for heart disease and death. How do race and ethnicity play a role in heart disease, Dr. Minhas?
Yeah, so in the U.S., we are increasingly appreciating that there are disparities in our health care. So it's both the access to health care, but then also the outcomes. So why is it that a Black person in the U.S. is more likely to die with a heart attack compared to a white person in the U.S.? And a lot of this goes back to what we call social determinants of health, or how social and environmental factors influence health. And that is probably the leading reason that we have disparities in healthcare and health outcomes in the US. And then, of course, there are some studies that show potentially genetic and epigenetic changes. So for instance, we know South Asians in particular have a fairly high risk for heart disease and diabetes. And could that be environmental? So could that be from the ancestry, so the country where somebody originally immigrated from, or from where their parents or grandparents came from? Or could it be related to genetics or epigenetics as environmental changes? And then lastly, like I said, the most important factor here is social determinants of health. Mm-hmm. So social and environmental and policy changes that can influence health.
Now, although we normally think of high cholesterol and high blood pressure as being risk factors afflicting predominantly adults, some children can have high cholesterol and high blood pressure as well. Isn't that true, Dr. Doshi?
Yes, and as Dr. Minhas explained in the beginning, we have this increase in obesity and overweightness in the United States, and this extends to children. And as a result, we are seeing increasing levels of high cholesterol, high blood pressure in children. And unfortunately, these are things that do not have symptoms like we saw before. These are kind of the silent killers, in that, especially with children, there's this expectation, oh, you're a child, you're healthy, where in fact they do have these underlying risk factors that can follow them throughout childhood into adulthood. And so it is important to see your doctor, see the pediatrician every year and have these things screened for. There is a recommendation to screen children now for cholesterol around age 12, and of course blood pressure screening should be done at visits as well. And generally the first line of therapy is dietary and exercise lifestyle changes, because those are fairly easy to, those are difficult to do often, but those are, if well established, those can be carried on throughout life, as opposed to adding medications, which then you're adding a medication that the child has to take for their whole life. And so it's important to establish those healthy habits early.
And so you alluded to the fact that high blood pressure and high cholesterol don't miraculously disappear after you've traversed the threshold of 18 and become an adult. Similarly, if a child is born with congenital heart disease, what should they do as an adult? And if they've had a repair, perhaps they had surgery as a child, do they continue to need lifelong care?
Yeah, that's a great point, because oftentimes these children born with congenital heart disease, congenital heart problems, will have some sort of surgery and have this impression that they are somehow repaired or fixed and everything is taken care of. Whereas, as we discussed earlier, there are lifelong consequences of this, and they can have certain complications later in life that do not affect children who have not had heart surgery. So it's important to continue to see their doctor, including in adulthood. And so something I make sure all my patients know about is knowing what heart problem they had, what surgeries they had, and making sure they know that they need to see someone as an adult. Oftentimes around that time of transitioning to adulthood, they go off to college, they kind of get lost to follow up, they don't come back and see their pediatrician anymore, and they feel fine, and so there's this impression that, oh, everything is fine, I don't need to see my doctor. But it's really important for those patients who have had any kind of a heart intervention or who has congenital heart disease to continue to see someone.
Thanks, that makes perfect sense to me. Now, a lot of people have started wearing Apple Watches, and wearable technology holds enormous promise with the ability to analyze large volumes of data to help prevent and treat people who have heart disease. So there's a Facebook viewer question asking, are there trackable metrics from smart devices that you would recommend you keep an eye on to maintain maintenance over your heart health? Dr. Minhas?
Yeah, so that's a terrific question, because just like you said, Dr. Cedars, most people now have a smartwatch, and what can we do with our smartwatches? So often, or a smartphone or a smartwatch, these things will track the number of steps that a person takes. So that can be one way to monitor how active you are. So recent research tells us that anywhere above 4,000 steps really per day could make a difference in lowering your risk of heart disease. And then even more steps, like 8,000 steps a day, might be even better in lowering that risk further. One can look at their heart rate. So often these smartwatches now can pick up heart arrhythmia. So if a person has atrial fibrillation, that could potentially be detected on their watch. Now, I don't think that we have any reason right now to recommend that people go out there and buy a smartwatch purely to be tracking and looking for these arrhythmias. But if one owns one, then it certainly makes sense to put it to use. And then lastly, these devices can store a lot of information. So for instance, not infrequently we'll have patients come to clinic who will have stored their blood pressure readings for the last month off of their home blood pressure cuff. And that can be really helpful when we're making adjustments to their medications, or their weight, or their cholesterol, be they somebody under 18 or somebody above 18. If they own a smartphone, it makes it a lot easier to record these things.
Yeah, it's really wonderful the way that wearable health technology may allow your patient to really be your partner in providing care for themselves. So finally, we'd like to end today with some healthy heart tips for both adults and kids. Diet, exercise, no smoking, get a healthy amount of sleep every night, manage your weight well, which means not too skinny but not too fat, keep your cholesterol under control with a combination of healthy and regular exercise and a healthy diet, manage your blood pressure, manage your blood sugar, and in general, do the things that you probably know you should be doing and that you're not doing because there's so many tempting things out there in life. Well, I think that's about all the time that we have for today. To learn more about heart-healthy tips and in keeping healthy, you can visit these listed websites or call the number on your screen. Thanks again for joining us today. Stay safe and healthy.